Hi everybody, how you doing? This is Dr. Tom Iannello from the North Owl Wellness Center in Miller Place. I'm sitting here with Sandy, who's been an awesome patient of mine for, I don't know how many years now, Sandy.
Must be
About five, 6
or
years.
6 years, yeah.
So it's an interesting story about Sandy. She and I have done a few things together. I remember when I first met her about 5, 6 years ago, she had this unrelenting back pain that was bothering her for the longest time. She had been to an orthopedist. She had been around the loop of all the different doctors, never really got anywhere. And what happened was she actually ended up in here because her daughter's a patient of mine. So sure enough, as luck would have it, I found a problem with her hip. I started adjusting her hip, and thankfully we were able to completely rejuvenate her, right, and recuperate her.
Absolutely.
To the point that she felt great. And everything was going along fine. She was kind of on a maintenance program with me as a chiropractic patient, and all of a sudden she developed some underlying problems that didn't seem to get better. She was feeling very tired. You were feeling a lot of pain. Your hips again, your legs. I remember her right, I think it was her right leg was just giving out on her. She had this searing pain. Nobody could figure out what it was. And, you know, I've been treating her chiropractically for so long. I said, if it's not chiropractic that's helping you, we're going to have to look at you from a different perspective. So what we did is I convinced her to try nutrition response testing. So what happened when you tried that with me?
I felt like 100% better.
And
it really worked.
Yeah,
it really worked.
So basically what we found is that she was nutritionally deficient in some minerals and some nutrients that supported her adrenal system. She checked for a various different group of supplements, and once she took them and put herself on a program, she just flew through it, did great, and everything went away. So we're moving along again. Here we are a couple of years ago doing okay into this following year, and now maybe about 8, 10 months ago. And I said, okay, Sandy, of all the things that were wrong with you, do we have anything left? And she's like, well, maybe, but you can't help me with that. I'm like, oh, well, now I want to hear what you have to say. So what was the problem that you had?
I had a ringing in my right ear.
And it was diagnosed as tinnitus?
Yes.
For how many years?
About 3 or 4.
About 3 or 4 years, okay. So 3 or 4 years of tinnitus. Now, tinnitus is a very tough problem. It's a ringing in your ears that comes from no known cause. Our medical doctors never can seem to find the reason for it. I've read a lot of books about what it might be caused from. But we basically found that she was lacking certain nutrients that would allow her body to just function normally. We had to calm down her nervous system. You know, ringing in your ears stems from stress on the laryngeal nerve that runs out of the ear. And if something aggravates that nerve on a certain level, it can cause a problem. So we gave her the nutrients that supported the weak ear area. And we followed the protocol, and sure enough, here we are, a number of months later. And when was the last time your ears rang?
I would say, a few months ago.
Okay, so
and then it stopped.
That's great. So now, no more.
No.
Completely gone.
No.
That's great.
Because I in bed at night and I don't hear anything ringing.
That's great. That's terrific. So I'm really proud of you. That's a great, because tinnitus is tough.
Happy.
Tinnitus is tough to get rid of. I mean, it can linger, and I've had patients for years that we tried with chiropractic to treat them, and it just wouldn't let go. And sure enough, in your case, it took nutrition, and it took, the additional services of the nutrients that we gave you in order to bring you to a healthier state. So I'm very proud of you. Congratulations.
I'm a happy camper.
Well done. Well done. Okay. So again, anybody out there, just understand that it doesn't matter how long you've had a problem or how old you are. Would you mind saying how old you are, Sandy?
67.
A young 67. You would have never known it looking at her, but she's doing great, and she's very active, and she's very healthy. So congratulations, Sandy.
Thank you.
Great job. Thanks for coming on today.
Thank you very much for having me.
All right. Bye-bye. Here we go, Sandy.